The book of 2nd Ezra chapter 15 and verse 17 in the GNT. There will no longer be free access to the cities. 2nd Ezra chapter 15 verse 17 in the KJV. A man shall desire to go into a city and shall not be able. All praises to Yahweh, Hashem HaMashah, Wahara Kakadash. Double honors to the elders and the apostles of the great millstone. Shalom to the hopeful elect that's seeking to be the elect of the nation of Israel. And scattered abroad amongst the heathens, I'm looking like the heathen. Looking at the 144,000 preacher trees and prophets. Shalom. Travel is going to eventually be cut off. All right, travel is eventually going to be cut off. Hey, it's nothing new under the sun. Let's go ahead and get that real quick. It's nothing new. Calling it round 2. Ecclesiastes chapter 1 and 9. The thing that has been, it is that which shall be, and that which is done is that which shall be done, and there is no new thing under the sun. Is there anything whereof it may be said, see, this is new? Finishing it off, it has been already of old time, which was before us. But you see, nothing's new, man. It's the same old playbook. U.S. travel.
The same people that complain about their car insurance being too high are the same ones being too lazy to go to the marketplace that's right below this video, put in the year, make, and model of their car. And
thank you all for staying with us here.
Just 9 hours ago, it says Ebola outbreak, U.S. airport screen travelers. And you know, you got this Memorial Day weekend now. These people gonna be out and about, moving and grooving. These people ain't thinking about nothing. Everything is a sham to these folks. Well, you can believe what you want. Esau is gonna turn to something else. And watch what happens. Watch. Y'all didn't enjoy Mother's Day. You got Memorial Day. They probably don't even wait June hit come Father's Day. Cause don't nobody give a damn about the fathers. They probably say, man, it ain't enough people that's gonna be on Father's Day. They even try to consider using it on Father's Day. So we'll just stick with Mother's Day that passed and Memorial Day. We're gonna see what they do. But hey, you see what's going on, man. It's the same old playbook. Several airports are screening airline passengers amid the Memorial Day travel rush as Ebola outbreak concerns rise. And I'm gonna just play the video. And you got airports starting to screen here in the United States and back east. So they're starting to screen people. All right. Those that, I think they say if you've been out of the country within 21 days or something like that. But she gonna say it. If you've been to Congo or whatever within the past 3 weeks, they're gonna screen them. But you see what's going on, man. It's nothing new. They're already talking about masking up and social distancing and using contact tracing like they did the first time. Don't forget that stuff's still on people's phones. Let's just play it. So hey, be circumspect, man, you know. Just know and understand what's coming. And this heat make things worse. You know?
Thank you all for staying with us here at Live Now from Fox as we are following the latest developments when it comes to an Ebola outbreak. It's happening over in the Congo and Uganda, but of course, health officials around the world are on high alert. And now we know that airports are screening their travelers amid this outbreak. Joining us live now is Fox 5's Stephanie Ramirez. She's there at Dulles International in D.C. Stephanie, what can you tell us about the screenings?
Yeah, well, the update is it's one specific airport, and that is Dulles International Airport. This is the international airport of the nation's capital in the backyard here. Now, DHS, Department of Homeland Security, they announced, and this started just before midnight, that now anyone who has traveled in the 3 main countries we're talking about here, the Democratic Republic of Congo, South Sudan, or Uganda, if they've traveled through those countries in the past 21 days of now trying to get back into the United States, they will now be be funneled to here at Dulles International Airport for special health screenings. Usually that entails or includes taking temperature checks as well as doing contact tracing if necessary. Not the first time something like this has been done before. DHS saying that this is to make sure that Americans are protected. Officials still saying that the risk to spread to the U.S. is low. May 15th is when Congo confirmed an Ebola outbreak caused by a strain that there is no vaccine for. An American doctor was the first to test positive. As an American, he was on a missionary trip for a nonprofit out of Pennsylvania and had to be evacuated to Germany for treatment after testing positive. As of last Saturday, the CDC had at least 246 suspected cases and at least 80 deaths reported in just Congo alone. And we know those numbers have grown. The incubation period of the strain, 2 to 21 days after exposure. That is according to the CDC. So we're at international arrivals now. The news catching folks by surprise. It is early. We reached out to the Metropolitan Washington Airports Authority, though, to find out more about what that is going to look like for any passengers who are flagged as having traveled to the 3 countries and anyone else aboard a plane with that specific traveler. But we did talk with someone waiting for a loved one to arrive this morning. He says he was a kid when we went through COVID, so he doesn't have the same fears that others may have when we talk about outbreaks, but this is his response to learning of the news.
I think that it is important to isolate those people, like the Henta virus, when they had them in the ship and they had them kind of quarantining. I think it makes sense to have everybody that has been affected in one spot so that they can actually take care of them instead of them being all spread out.
It's better to screen and monitor from a single location. So it's a way to simply manage potential exposures people are exposed to.
Do you think this will prevent people from flying? Do you think people will stop flying because of this?
Ebola is not something new. Ebola has been around since the 70s, so more and more people know about it. So I don't think it should have an impact unless until you see a huge outbreak, which I don't foresee happen. So it's good to be vigilant. We've been working on Ebola for more than 10 years.
I guess that second gentleman you just heard from there tells us he is actually someone who works in infectious disease research in the greater D.C. area here. Now, there is no end date to this DHS order at this time. Again, officials still saying that the risk of spread of Ebola in the U.S. is still low, but taking these precautions. We do know some airlines are also reaching out to non-U.S. nationals and suggesting that they reschedule their flights to the U.S. at this time because of these precautions and restrictions being put in place. It's the very latest here from Dulles. I'll send it back to you, Crow.
All right, Stephanie Ramirez there with our team at Fox 5 in DC. Stephanie, take care, and we'll check in later. I want to bring us out to a social media post courtesy of the CDC because, again, we are on high alert, even though the risk of exposure from Ebola is low, according to some health officials. The CDC, the World Health Organization, following these developments closely. This social media post in particular is from a couple of days ago, but it stays relevant today as we are seeing some of these screenings happening at airports, not just across the U.S., but across the world. It says this: CDC and federal partners are implementing proactive public health measures to help prevent the introduction of the Ebola disease caused by the BDBV virus into the United States. These actions include enhanced traveler screening and monitoring, coordination with airlines and ports of entry, strengthened hospital and laboratory readiness, and continued deployment of CDC teams to support outbreak response efforts abroad. Effective immediately, additional entry restrictions will apply to non-U.S. passport holders who have traveled through affected areas in Uganda, the DRC, or South Sudan within the past 21 days. CDC assesses the risk to the general public is low, the U.S. public, that is. Travelers from affected areas should monitor their health for 21 days and seek medical care immediately if symptoms such as fever, weakness, vomiting, diarrhea, or unexplained bleeding develop.
Instant happiness is here at Rent-A-Center. You could get instantly approved for up to $4,000.
So there you have it. Let's pull up the airports. That screening. It's 1, 2, 3, 4. It's 5 of them. Pull it up so you can see it instead of me just reading off the phone. What? Ebola. That's not the only one. Come on, y'all, stop playing. What airports in the U.S. are screening? That's not the only one. I'll read off my other phone. It says, I typed in the same thing. It says Chicago O'Hare International Airport, ORD, Washington Dulles International Airport, IED, John F. Kennedy International Airport, JFK in New York, Hartsfield Jackson Atlanta International Airport, ATL, Newark Liberty International Airport, EWR in New Jersey. And that's what it says on this phone. But right here, just saying Washington Dulles International Airport, IED. Let's see if we can type it in again. Let's see. Damn, know what the hell? What? Let's type it in. List of airports in the U.S. Let's see if it'll come up. Yeah, it's saying the same thing, but on my other phone, it's those 5. But anyway, we'll see what happens, and be circumspect, man. Pray for the worst, and that worst is upon Babylon, and that's prophecy. So we praying for it. So bring back the old measures, bring it all back. Stay prayed for the names of how about you,